Hello and welcome to this educational series called Welcome to Medicare. This program is presented by the Wisconsin Department of Health Services, which operates the Wisconsin State Health Insurance Assistance Program, or SHIP, a local public service for people with Medicare. Every state has a SHIP program. In Wisconsin, you can get free and unbiased help with Medicare from local SHIP counselors. You can download the slides to this presentation by clicking the link in the YouTube video description. This project is supported by a grant from the Federal Administration for Community Living. This program will provide an overview of Medicare and is divided into 6 parts. You can find this information in greater detail in your Medicare and You handbook, which is mailed to people with Medicare and can also be found on the Medicare.gov website. For easier understanding, you are encouraged to view the parts of this series in order. Welcome to part 3 of this educational series. In this section, you will learn about your Medicare coverage choices, Original Medicare, and Medicare Supplement Insurance, or Medigap. There are 2 main ways to get your Medicare coverage, Original Medicare or Medicare Advantage plans. You can choose which way you want to get your coverage. Original Medicare includes Part A and/or Part B. We talked about some gaps in Original Medicare, like the deductibles and coinsurances. You can add additional coverage to help cover those gaps. You can buy a Medicare supplement insurance policy to help cover the gaps in Original Medicare. You can also choose to buy Medicare prescription drug coverage, or Part D, from a Medicare prescription drug plan. And Wisconsin Senior Care Program is another option, either alone or in addition to Part D. Medicare Advantage plans, also known as Part C, are an alternative way to get your Medicare benefits. They are offered through private insurance companies that are approved by Medicare. There are different types of Advantage plans, like a health maintenance organization or a preferred provider organization, and they cover Part A and Part B services and supplies. Most Medicare Advantage plans include Medicare prescription drug coverage. You may be able to add drug coverage to some plan types if it is not already included. And Senior Care can work with Medicare Advantage plans as well. We'll talk more about that later. Medigap policies don't work with Medicare Advantage plans, so if you join a Medicare Advantage plan, you can't use Medigap policy to pay for out-of-pocket costs. Let's start by looking at the options on the left side of this chart, Original Medicare, and then we'll see how Medigap works with it. Again, Original Medicare includes Part A and/or Part B. You can go to any doctor, hospital, or other healthcare provider that is enrolled in Medicare and is accepting new Medicare patients. The costs are affected by whether or not they accept assignment, which is an agreement by your doctor or other provider to accept the Medicare approved amount for the service and not to bill you for any more than the Medicare deductible and coinsurance. With Original Medicare, you can choose to buy a Medigap policy to help cover some costs not covered by Original Medicare. You can also choose to buy Medicare prescription drug coverage, or Part D, from a Medicare prescription drug plan. Original Medicare doesn't cover everything. Some items and services not covered by Medicare include long-term care, acupuncture, most dental care or dentures, cosmetic surgery, health care while traveling outside the U.S., hearing aids and/or exams for fitting hearing aids, most routine foot care and most supportive devices for feet, routine eye care and most eyeglasses, and routine physicals. If you need these services, you will have to pay for them yourself unless you have other coverage, including Medicaid, to cover the costs. Now we will talk about Medicare Supplement Insurance, or Medigap. A Medicare Supplement Insurance Policy, or Medigap, is a private insurance approved and regulated by the Commissioner of Insurance and helps fill the gaps of Original Medicare, like copayments, coinsurance, and deductibles. You must have Part A and Part B to buy a Medigap policy. You pay a monthly premium for a Medigap policy, and the costs depend on the insurance company. Optional benefits selected, your age, and where you live. Once Medicare pays its share of the Medicare approved amounts for covered health care costs, then your Medigap policy pays its share. A Medigap policy does not include prescription drug coverage. There is no need to review your coverage each year. There are different types of Medigap policies. With traditional Medigap policies, costs may be based on attained age, where your premiums become higher as you reach higher age ranges, or issue age, where premiums are set at the age you are when you buy the policy and will not increase because you get older. Premiums may increase for other reasons and may increase each year due to cost of living adjustments. There are also cost-sharing policies, high-deductible policies, and Medicare Select policies. For more details, you can request a publication from the Wisconsin Office of the Commissioner of Insurance called Wisconsin Guide to Health Insurance for People with Medicare, or you can view it from their website. The basic benefits for a Medigap policy include coverage of the Part B 20% coinsurance, covers the Part A copayments for hospitalization and skilled nursing care, additional psychiatric care, the first 3 pints of blood if needed, and 40 additional home health care visits. All Medigap policies sold in Wisconsin must include a few additional benefits. This includes the usual or customary cost of non-Medicare covered chiropractic care, as well as coverage of 30 days of non-Medicare skilled nursing facility care with no prior hospitalization required. Again, the Wisconsin mandated benefits only apply to policies that were issued in the state of Wisconsin. It is important to decide which optional riders or extra benefits you may be interested in purchasing with your Medigap policy. If you take the Part A deductible rider, that deductible is paid for you by your Medigap policy. You can also decide whether you want the Part B riders for the deductible, copays, or excess charges, additional home health, or emergency foreign travel. Please note, as of January 1st, 2020, the Part B deductible rider is no longer an option for people newly eligible for Medicare. It is still available for those who are eligible prior to January 1st, 2020. Before comparing the cost of different policies, be sure to decide which riders you want. Here are the steps to take if you are interested in buying a Medigap policy. Step 1, decide which benefits or riders you want. Step 2, find out which insurance companies sell Medigap policies in your state. Step 3, call the insurance companies that sell the Medigap policies and compare costs. Step 4, buy the Medigap policy. The best time to buy a Medigap policy is during your Medigap open enrollment period. This period lasts for 6 months and begins on the first day of the month that you're 65 or older and enrolled in Medicare Part B. If you apply during your Medigap open enrollment period, it is considered your guaranteed issue period, and you can buy any Medigap policy the company sells, even if you have health problems, for the same price as people with good health. If you don't purchase a plan within your 6-month open enrollment period, insurance companies can deny coverage based on your health condition. While the insurance company can't make you wait for your coverage to start, it may be able to make you wait for coverage related to a pre-existing condition. Remember, for Medicare covered services, Original Medicare will still cover the condition, even if the Medigap policy won't cover your out-of-pocket expenses. You may buy a Medigap policy anytime an insurance company will sell you one. Remember the rules about delaying Part B. If you delay enrolling in Part B because you or your spouse are still working and you have group health coverage based on that employment, your Medigap open enrollment period is also delayed until you enroll in Part B. Once your coverage ends or your employment ends and you enroll in Part B, your 6-month Medigap open enrollment period begins. For those who may have Medicare due to disability, you will get a second open enrollment period when you turn 65. These are other times that you can receive guarantee issue and not be denied a Medigap policy. If your Medicare Advantage plan terminates or stops providing care in your service area, if you move outside the plan service area, if your employer group health plan ends some or all of your coverage, if your employer group plan increases costs by more than 25% in one 12-month period, if you're in the trial period of Medicare Advantage plan, this is a 12-month period. The first time you join a Medicare Advantage plan, you get only one trial period in a lifetime. For guarantee issue of a Medigap policy, you must apply within 63 days of your other coverage ending. If you have questions or would like more information about Medigap policies, you can contact the Wisconsin Medigap Helpline at 1-800-242-1060. For information or to receive publications about Wisconsin-approved policies, contact the Wisconsin Commissioner of Insurance at 1-800-236-8517 or find them online at oci.wi.gov. You may also call Medicare at 1-800-633-4227 or visit the Medicare website at www.medicare.gov. This concludes Part 3 of the Welcome to Medicare series. I hope this information has been helpful. The next section in this series will discuss Medicare Advantage plans and other types of coverage. This presentation was brought to you by the Wisconsin State Health Insurance Assistance Program, or SHIP, a local public service that provides free and unbiased help to people with Medicare. If you have questions about Medicare, you can call the Medigap helpline at 1-800-242-1060 or visit the Wisconsin Department of Health Services website to find a local SHIP counselor near you.